webinar is being recorded this morning. So if you are joining us live or if you are joining us later on with the recorded version, welcome, and we thank you for sharing this space with us to learn more about what our Healthy Northeast Ohio website has to offer. Today is Tuesday, February 23rd, and we are very excited to bring you some great information that will hopefully be of great value and use to our partners in Summit County. We are utilizing WebEx this morning, so if you are seeing a PC version of WebEx, you would find the chat box located in the bottom right-hand corner of your screen, as you see here on the slide. So please do refer your questions to all panelists. I believe the default might say host, so if you could please just refer them to all panelists, that would be fantastic. We will be sure to address these questions and weave them into our content this morning, but at the very least, if we do not address your questions during our content, we will definitely address them at the end of the session. My name is Livia McGraw, and I am the Regional Community Health Improvement Manager at the Center for Health Affairs, and I also serve as a site administrator for the Healthy Northeast Ohio program. And I am going to go ahead and invite Sarah Sabo, who is our data analyst, to go ahead and introduce herself. Sarah?
Thanks, Libby. Good morning, everyone. Again, my name is Sarah Zabo, and I am a data analyst at the Cuyahoga County Board of Health. And then I also serve as a data analyst and a local site administrator for Healthy Northeast Ohio. So thank you so much for joining us this morning.
Thank you, Sarah. In the background today, we also have Allie Goff, who also works at the Center for Health Affairs, who will be doing some background technical assistance for us. And also with our Healthy Northeast Ohio team, we have Patricia Tursteniak. She serves as the Director of Community Health at the Center for Health Affairs. She is unable to join us this morning, but she does round out that team for us. And to provide you some background information with the Center for Health Affairs, the center is a hospital membership association, and we serve 36 hospitals in 9 counties. We do set ourselves to be a convener, influencer, and innovator that helps impact the communities we serve. I'm going to go ahead and provide us with some background information to kick us off this morning, and then I will provide some resources to share and use. We also will have Sarah participating with some information about data, functionality, and features on our website. These are our objectives for this morning. We really would like to give everybody a great sense of all the information that we have to offer on the website and how that might be valuable to you and your community and the programs that you specifically work in. So I will go ahead and give you a moment to review those objectives. Now, to provide you with some background information about the Healthy Northeast Ohio program, it is a publicly free and available website that can be accessed at healthyneo.org. We launched back at the end of 2019, so our website has been live and active for a little over a year. You can see here that we have a little over 5,000 users since we started back in 2019, which is very exciting for us. We maintain a presence in 7 counties in the Northeast Ohio region, with Lake County and of course Summit County being the latest 2, in addition to Ashtabula, Cuyahoga, Lorain, Medina, and Portage counties. Our website serves as a neutral data repository for population health information. Our partners are able to utilize our website to expand and improve those targeted community health efforts. We do have over 225 health indicators available from over 30 different reputable sources. This data is available at county levels, zip code levels, and census tract levels, so it really does provide a nice variety of information for you and your programs. The web-based platform that we utilize was created by our vendor called Conduent Healthy Communities Institute, and the data that we have access to through our website is largely maintained and curated by Conduent HCI. This work is supported by a grant from the HealthCom Foundation and from contributions from our partners in the hospital and public health sectors. So we are very excited to be able to conduct this work and to improve those health outcomes across the Northeast Ohio region. So we're going to go ahead and break the ice this morning with a poll. So give me one moment and I'm going to go ahead and pull that up and open it for all of you. And we are asking about how often you have used Healthy Northeast Ohio. Have you used it before? Maybe you used it, but only a little. Have you seen others use it? So if you go ahead and take just a moment to answer that, we will go ahead and review those answers momentarily. Okay, great. We are getting some great responses here. So I'm going to give it just another moment or two, and then we'll go ahead and close the polling out. Okay, thank you so much, everybody. So by now you should be seeing the poll results, and it looked like we had a nice variety. Some of you have used it, but only a little. Some of you have seen others use it. We had a lot of you who said you have never used it before or seen it. So for all of those, welcome and thank you. That's wonderful to hear. We hope that if you are a repeat user, you maybe can walk away today with some new information. And if you have never been with us before, we hope that you do walk away today with a nice overview of information. So thank you again for that participation. We are going to move into the first part of our demonstration this morning. I'm going to be providing a high-level overview of the website, including the homepage and some of our other key pages that we find useful to our partners. So our website, again, can be visited at healthyneo.org. No login or credentials are needed because it is free and publicly available. You will notice at the top of our website, we have a navigation bar, which will help navigate you through all of our various pages on the website. At any point, if you get lost in a page or you would like to return to the home page, you can click on our logo in the top left-hand corner, and that will bring you back home. We are predominantly featuring our COVID-19 update, as many health-affiliated websites and organizations are at the moment. So we'll revisit this resource in a little bit this morning. We also have some direct links to view all data, to do a search for health data or topics related to any of our indicators, and Sarah will be covering this in detail in just a few moments. As you continue on in our website and on our homepage, you will find access to our county-specific web pages, and you can also access these through the Explore by County bar at the top of the page. We have a What's New section where we feature some news and updates. Right now, you'll see we're featuring a Food Insecurity Index, which was recently added to our platform. So you'll see some updates that get populated here regularly. We also have a data spotlight, and this is updated monthly. This month, we're featuring a coronary heart disease data indicator for Lake County. And then lastly, to round out our homepage, we do have a scrolling view of all of our partners listed here with their logos. So if you'd like to visit any of our partner sites, you can click directly on their logo at the bottom of the page, and it will reroute you to their website. So I'm going to go ahead and visit the Summit County specific page. And again, you can access this page through the Explore by County tab at the top. And you'll see immediately right at the top that we have some background information to give our site visitors some context about Summit County. So here we have our population for Summit County listed, some other demographics information. And we also have some links to the county health rankings so that you might examine more where Summit County ranks compared to other counties in Ohio. And if you continue on the Summit County page, you'll find 2 rows of different buttons with different access points for our various data indicators that we have available for Summit County. We also have a direct link to the Summit Coalition for Community Health Improvement site. We know how important their efforts are in improving community health in Summit County, so you can access their efforts directly here. And then in the second row of content here, you'll find the different implementation strategies, community health improvement plans, and the needs assessments. And we know that these documents are very important and instrumental for the health department and for the hospitals as they develop their community health improvement plans, strategies, priorities, and so forth. I'm going to specifically showcase the demographics page this morning. This is one of our most popular pages, and this is just one of our many dashboards that you'll find on our site. Here you'll find many different tabs with our various demographics indicators, and there are quite a few of them. So if you'd prefer to view these in a listing view, you could click this raspberry button in the top right-hand corner that says View All Demographic Variables, and this would allow you to view this in a listing view. If at any point you would like to switch the location that you're looking at the demographics information for, you can click this drop-down, and it will allow you to change that location. You'll see that our information and the data that's available is laid out in different ways, which makes it really nice for our consumers to have a variety of data to consume in different manners. And at any point, if you'd like to retain any of these graphs, you can click on these 3 lines and you could download that information as well. So I'm going to go ahead and take us to another helpful tool that you might like to use as you're starting to explore our website, and that's going to be the Topic Center. So in our footer, you're going to see a series of icons and images, and these are some of our topics that you can explore. I'm going to go ahead and click on social environment just to kick us off. And this is a great way to bring together related content. So if you're just getting started with exploring our website, you'll be able to use this feature, and that can bring together that like material. So here you'll see that we have indicators that are available related to social environment, different resources, promising practices, and other resources that are available. So you'll find and again, as we continue on through the demonstration this morning, there are a lot of opportunities to really find this related content. That's the nice thing about the vendor that we use, is that they always have these algorithms that are pulling this information together, really to make your viewing experience and your data search a lot easier. So that's a little bit about the Topic Center. You can click on any of the different icons at any point to switch what topic you are viewing. You can also use the drop down to click on a subtopic, and that can help in continuing on that search for information and data. And the last couple of things I do want to point out, first, we do have this help button that you'll see in my bottom right-hand screen, and this can be a quick search if you're looking for information, but I specifically want to point out our FAQ that's available in the footer of our page. And this is a page that is managed by our vendor, by Conduent Healthy Communities Institute, and it has a great series of answers to common questions that folks who visit our site might have, and other like sites such as this one. So here you see that there are a lot of different questions and a lot of different answers. For example, we get a lot of questions about how to cite data from our site, so you could visit the FAQ page to get that information. Perhaps you're viewing an indicator and you're unsure what an age-adjusted rate is. You might want to visit the FAQ for more information about that as well. So that is a little bit about our homepage and about some of our other key pages. And I'm going to go ahead and turn it over to Sarah, who is going to talk about all things data.
Thanks, Libby. Just give me one moment to go ahead and share my screen. Libby, can you confirm, are you seeing the homepage?
Yes, I am. Thanks, Sarah.
Perfect. Thank you. Okay, again, good morning, everyone. As Libby shared, I'm going to be walking you through mainly the Explore Data tab to show you how to search for data on the site, and then also how to create some customized data visualizations using tools that are available. And as Libby said, we know firsthand how time consuming it can be to find and pull data from multiple places. So after the webinar today, we hope you see the value of our site, that it really does centralize this data and hopefully makes your jobs easier. So the first thing I am going to do is I'm going to show you how to search for data on the site, and keep in mind that there are a few ways to do this. As Libby showed on the homepage, there's a search bar that you can search by keyword. But I'm going to first take you to the Explore Data tab and the indicator list by location page. So this is, one option, especially if you're new to the site. I would recommend that you check out this page. But basically what it does is it lists all of the indicators that are available on the site, and then it shows you what demographic levels of data are available for those indicators. And as Libby shared, we do have nearly 225 indicators coming from more than 30 sources, and those are state, national, and other sources. And most of this data is curated and maintained by Conduent, but there is the option to add local data to the site. So as you can see in this list, all of the indicators are organized by topic and subtopic, which is nice. I'll scroll just a little bit so you can kind of get a sense of this page, but it's a fairly long list, so I'm definitely not going to go all the way down. If you're interested in, for example, diabetes, this is a way to get just a quick snapshot of the data that would be available. And then again, going across the right, these columns show you the geographic levels of data that are available. And again, we do have data for the 7 counties in the Healthy Northeast Ohio region, as well as the municipalities, zip codes, and census tracts that make up those counties. And do just keep in mind that the availability of the data just depends on the source that it's coming from. And you can save this list to a CSV file if you're so inclined, just by clicking right below indicator list by location. So again, new users, I would recommend that you do come to this page. Another option to search for data would be, again, using the Explore Data tab and then clicking Search for Data. So here you can see we can do a keyword search. You can use these drop downs to find a specific indicator or search by a specific location. So for the sake of example, I'm just going to go ahead and do a keyword search, and I'm going to search for adults 65 plus, as I know the aging population was a priority in the Summit County CHIP. So what you're going to see now is a list of all of the related indicators that are available on the site. And if you see an indicator that you are interested in, you can go ahead and just click on it. So I'm just going to show you this list a little bit. So it's pretty good list we have for this topic area. So I'm going to go ahead and click on age-adjusted death rate due to falls. So if you click on that, you're then going to be prompted to select a location. So I'm just going to use this drop down because I'm interested in looking at Summit County. Now we are viewing what is called the indicator detail page. So this is where you can read all about an indicator. Just below the name, you're going to see the location you selected, as well as the measurement period, which can be adjusted using this arrow. You'll see text describing what the indicator is, as well as why the indicator is important. If I scroll just a little further, you're going to see the current value for Summit County here. And then the website does use a variety of gauges and icons and colors to make or to show comparisons and trends. So to the right here, you'll see all of these various gauges and dials. You can hover over them and you'll see a quick description of what that particular icon is telling you. So it looks like the value for Summit County for age-adjusted death rate due to falls is falling within the best 50% of counties in both the state and the country. It looks like Summit County's value is lower and better compared to the state and the country. And it looks like the Healthy People 2020 target for this indicator is being met. Oops, on the left, just below the value, you're also going to see the source of the data, again, the measurement period, who maintains the data, and then when it was last updated. On the left, I did want to point out, we do have a legend. So if you click see the legend, it'll expand. And this is just a quick way to get a description of the various color coding that is used, and then those gauges and icons. And you can just click hide the legend and it'll minimize. So here you're going to see this change over time graph is available, and as Libby shared with the demographics dashboard, all of the charts and the maps on the website you can download, again, just by clicking this 3-bar symbol. If the indicator that you're looking at does have subgroup data available, you're going to see that here. So it looks like this particular indicator has data available broken out by gender. So that's why we're seeing this graph here. And then there's also a map. So this is showing the counties in our project region right now, as well as this bar graph. And then at the bottom, there's always going to be a table as well, listing the values. And this data can be downloaded to a CSV file, again, just below that table by clicking download county indicator data. And then the last thing I wanted to mention on this page, as Libby shared, the website does do a nice job of bringing together related content. So you're going to see down at the bottom, a list of any of the other indicators that are related to the one that we selected, as well as promising practices. So hopefully that gives you a better sense of how to search for data on the site. As I shared, there's a couple ways you can go about it. Another thing that I wanted to show you all today is that the website does have several specialty dashboards in addition to the indicators that are available on the site. And a dashboard is just a collection of indicators around topic, location, or something else that you're interested in. So the first specialty dashboard, which again, these can all be found within the Explore Data tab, is the demographics dashboard. So I'm not going to show you that because Libby did, but just to reiterate, we currently have 250 demographic variables that are available, and those are available at the state, county, and zip code levels. And then in that dashboard, as Libby showed, you can pull different visuals. And if you look at a specific variable, there's mapping available as well. The next specialty dashboard is the disparities dashboard. So if you're interested in looking at differences in health between groups, you could use this dashboard to help identify those groups to focus your program or maybe policy efforts towards. So this dashboard shows all of the indicators that are available with breakout data. So by race, ethnicity, age, and then gender. There's a drop-down arrow that you can use to select a location that you're interested in, and then it will filter it by that location. So again, I'll just scroll a little so you can see this. Another specialty dashboard, which was featured in our What's New section, is the Food Insecurity Index. So this is a brand new tool that was just released within the last few weeks that was created by our vendor, Conduent HCI. And this is a measure of food accessibility, and it's calculated using social and economic factors like household expenditures that might impact a household's ability to purchase food. This index can be used to help identify areas in your community that are estimated to have the highest food insecurity. And then in a nutshell, basically how this works is that all census tracts, zip codes, and counties are given a national index value that ranges from 0 to 100, with 100 being high need. And then those index values for each location in a community are then ranked from 1 to 5, with 5 being high need. And if you are interested in learning more about Conduent's methodology, you can click on how does it work or learn more. So here we're going to see the Food Insecurity Index map. Excuse me. The darker the green indicates the higher the estimated food insecurity. So right now, the default is set at the zip code level, and it's showing all of the zip codes from the 7 counties in our project region. But if you did want to narrow that down, I wanted to point out just below the map, there's some filtering options. So for view level, if I select county, and then, oops, pardon me, if I select Summit County, and say, for example, I'm interested in looking at the census tracts in Summit County, I could zoom in then. And these maps are interactive, so I could turn on labels, I can change the background or the transparency of the map. And again, you can export these maps. And then just below the map, you're going to see this bar graph. And this is filtered right now for the census tracts for Summit County, just because I did that just below the map. But it's always so striking to see the range of need that can exist within a community. And I think we see that here. And there's also going to be a table of those index values, and then as well as the rankings. And again, this table is filtered because I made those selections above. You can download the Food Insecurity Index data by clicking CSV here to the right. So again, that's a brand new tool. We encourage you to definitely check this out. Another specialty dashboard is the Socio Needs Index. So this is another tool that was created by Conduent HCI, and it summarizes multiple socioeconomic indicators into one composite score for easier identification of under-resourced areas. And this is also available by the county, zip code, or census tract levels. The methodology is similar, so I'm not going to repeat that, but feel free to visit this page to learn more. Again, you're going to see a map where the darker the blue indicates the higher the need. And again, you have all those same filtering options. You can download this map, and then you'll see a bar graph and a table, as well as the option to download this data. And the last specialty dashboard that I'll mention is the Healthy People 2030 Progress Tracker. So this progress tracker shows how a location compares to the Healthy People 2030 10-year national objectives for improving health. So again, you can select location. And this is one of the easier dashboards, I think, to interpret. It really just has 2 icons. So you're going to see a red X or a green check indicating whether or not that target was met. And the site is still including the Healthy People 2020 targets, and the Healthy People 2030 targets were more recently added. So those are the specialty dashboards on the site. Next, I want to go ahead and walk you through how you can create a custom dashboard on the website. So this is another way to visually represent data on the site. And just scroll down so you can see this. But a dashboard basically shows a summary of the indicator that you'll see in this value column, as well as any comparisons, for example, to other counties in the state or the US, any national benchmarks that are available. So you'll see all those comparisons to the right. These dashboards are dynamic. So as the data on the website is updated, your dashboard will also be automatically updated. And you can use this tool to help with, reports, presentations, maybe even grant applications. And you can embed a link to your dashboard in a document or, even post it on a website if you want to. So this is an example custom dashboard that I created. I saw that chronic disease is another priority in the Summit County CHIP. So given that, I included some indicators related to exercise, tobacco use, and then food access. So again, you can see the current values for Summit County. It looks like, for example, adults 20 plus who are sedentary, that healthy people target is being met. Adults who smoke, it looks like that target is not being met. And if you're interested in making your own dashboard, I'm going to go ahead and just scroll up and show you how you can do that. So you would go to Explore Data and then build a customized dashboard. So custom dashboards can be built in one of two ways. They can be built using the filter indicators option or the handpick indicators option. And I'm using the handpick indicators option because I had specific indicators in mind that I wanted to include. The filter indicators option does have a few more filtering options, but you do have to filter by topic rather than by specific indicators. So, just pick whatever works best for you. So in this first field here, you can see it is a drop-down field, but you can see the various indicators that I've selected. The second field is your location. So I've selected Summit County. To the right, you can see that if you use this drop-down arrow, there's a map view. So you can click on that and a map will appear that you can physically click on the locations you want to add. There's also the option to select all of the census tracts or zip codes in Summit County if that is something you're interested in. But once you've made all of your selections here with your filters, you would just go ahead and click search, and then your custom dashboard is going to show. One other thing I wanted to point out about the dashboards is that right below search results, if you see this box icon, that can change the view of your dashboard. So we're looking at it right now in what's called the list view, which is like one row per indicator. But another view is the card view. So I'll go ahead and click that button. So now you're going to see the dashboard in the card view. So each of these are what's called an indicator card. And what's nice is that you can save these individual cards. Like this might be easy to, pop into a PowerPoint slide, for example. And then, as I mentioned, you can save your dashboard. So again, below search results, if you click save a link to this search, this URL will show that you can then copy and paste into, an email, a document, etc., to visit it or share it with others. Go ahead and click out of that. So again, that's how you create a custom dashboard on the site. We do hope that this tool is useful to you. And I'm going to go ahead and stop sharing, and I'm going to turn things back over to Libby. And she's going to walk us through some of the other tools and resources that are available on the site.
Thank you, Sarah. As I am getting my screen prepared, we did have a great question come in that I'm hoping you could address. And our question was, is gender limited to male and female identities across the website for all data? And I can speak to that too a little bit as well. So Sarah, I will say that we are limited in, oh no, you're fine.
I'm sorry, I forgot to unmute.
No problem. Go right ahead and I'll go ahead and prepare my screen as you're answering that question.
Sure. Yeah, I was going to say it is, for the indicators, it is limited to male and female.
That's a great question. Okay, we are going to go ahead, and our hope is that as data collection does improve among the different sources that we do retrieve data from, that will hopefully also be reflected in the data that we have access to as well. So again, great question. And I'm going to go ahead and open up our second poll. So you should start to see that poll being displayed, and we are asking about how often you use secondary data. So go ahead and take just a few moments to complete that, and then we will move into the next portion of our demonstration this morning. Okay, great. I see some of these results coming in. We will give it another moment or two, and then we will go ahead and close that poll out. Thank you, everybody, for participating in this. We appreciate it. Okay, great. So we are going to go ahead and close that poll, and you should start to see those results come through as well. We had, again, a nice variety of responses. Some of you do use secondary data all the time. Some of you use it a few times a year or only when needed. Some of you hardly use it ever. No wrong answers with this one. We just hope that through this demonstration today, that secondary data becomes more accessible to you. And in addition to that, hopefully this also sparks some new ideas on maybe ways that you could access secondary data or utilize it as well in your own work. So we are going to go ahead and move into the next portion of our demonstration. And I'm going to be taking a few moments just to cover some key tools and resources that we have access to through our website. So under the Tools and Resources tab, the first one that I'm specifically going to point out is the Promising Practices database. This is maintained by our vendor Conduent, and it's a great resource. I have a background in public health education specifically, so I really appreciate this resource because I think it's a great way to find some evidence-based programs and find some information if you are in that planning phase and just starting to think about different ways that you could use various programs. So there are 3 different types of promising practices that you'll find in here. There will be evidence-based practices, effective practices, and good ideas. And you can learn more about the ranking methodology at this hyperlink, and that will walk you through the criteria that must be met for the promising practices. We do know that there are a lot of great programs being conducted throughout Northeast Ohio, so we invite and encourage all of our partners to submit a promising practice if you have something that you think might qualify and meet that criteria. This is a database that's utilized across the nation as well, as you'll see here with some of the different variety of locations that we have programs from as well. So we would love to showcase some programs from Northeast Ohio as well. So I'm going to walk you through how to utilize the filter to narrow down your search results if you are using the Promising Practice database. You'll see here under the search filter that we have over 2,300 programs in here, which is quite a few. So we will go ahead and walk through some of these steps so that we can help you narrow down that search. So I'm going to go ahead and do a search for infant mortality related programs. And this is a priority area for Summit County's CHIP that we identified as well. We're going to do an evidence-based practice. As you continue on through, you'll see that you can also select a target audience. So I'm going to go ahead and select women. You could also select a subtopic or another topic. You also have an option for geographic type. And because Summit County is considered an urban community, I am going to select that. And let's see what that populates for our search results. And we can see here that that search filter limited us down to 5 results. So that's a much better number to play with as you're exploring information and content. Again, as Sarah pointed out, you could save a link to this search if you want to revisit it, or if you would like to send it to somebody. I'm going to go ahead and click on this first program on the left. You'll see that you have a list of where the program is, the title of the program, and a little bit of background about that program. But we'll go ahead and examine this first one. And you can see, first of all, underneath the title of the program that it is an evidence-based program, and you can find out more by hovering over the icon about why it meets that criteria. You can identify some information about the program. Here it has listed some goals, the results. Also, if you continue to scroll down, you'll find information about the entity that did submit that promising practice. So this might be particularly helpful if you're looking to connect with another program that has already done some of this work. Again, as Sarah pointed out, we have, and as we've mentioned a couple times this morning, we have some great related content that populates with this feature as well. So here you have some indicators related to infant mortality, different funding opportunities, websites, etc. And then if you scroll back up, another great little tool as you're continuing on that search for some prevention programs, you'll see this related promising practices box, and you can continue on your search for related programs that way as well. So that is a little bit of background about our promising practices database. Again, it's a great tool for those who are working in the programmatic sector for community health programming. We have a lot of different resources here, as you can see in the drop-down bar. The next one that I'm going to specifically point out is the COVID-19 resources. And here, as many different entities are right now, we want to make sure that we're featuring COVID-19 information because it is so needed at the moment, and we do update this regularly. So here in the left-hand column, you'll see that we have some quick access links to COVID-19 related data. In the middle column, you'll find that we have some direct links to the local hospitals and community health centers, and this will link directly to their pages with access to that vaccine distribution information. And then finally, in the right-hand column, you'll see here that we have links to the city and county public health departments, and you can select any of these, and this will take you directly to their page that also features vaccine distribution information. As you continue on the COVID-19 resource page, we do have a couple other links for the Ohio Department of Health, the Centers for Disease Control, and then we also have linked the Ohio Department of Health vaccine dashboard here as well. So that is a brief overview of our COVID-19 resources. We also have, I'm not going to necessarily take us there today, but we also have a funding opportunities resource, and this is another database that's maintained by our vendor Conduent, and this has access to national and federal funding opportunities. So this is maintained and updated pretty regularly with funding opportunities. So that's a great resource as well. We do invite you to explore all of our tools and resources, but the last one that I'm going to specifically showcase today is our resource library. And our resource library has a great deal of resources for community health partners. You'll be able to see here that we have some of our resources sorted by type, also by title and topic. So you'll see that we have different fact sheets, press releases, websites. We also have some reports in here as well. If you are looking to kind of narrow down that search, you can use the filter here as well if you click on that pop-out button. And this will allow you to filter and search just kind of how we did as well with the promising practices. And you'll see that we have about 148 resources in here, so still quite a few. If you don't want to filter with that tool, you can also use our search bar here at the top. If you do have a resource that you think would be beneficial to live in our resource library, you can submit that here. And then also, one of the last features I will point out with our resource library is our collections option. So the resource collections have a series of titles that, again, are just a quick way to bring together some related content. So let's say you're looking for some information about health equity, you can click on this collection title and it will take you to all of our resources that we have available in our resource library regarding health equity. So that's a quick and easy way to locate some of our resources as well. And that is a little bit about our tools and resources. So again, we do invite you to explore all of those. There's a great deal of information there to also kind of help supplement some of that information with the data that you've seen this morning. Before I do turn it back over to Sarah for the next part of the demonstration, I will point out just a couple things. At any point, if you're looking to learn more information about how to use this site, you can visit the Learn More dropdown and you can click on this How to Use the Site page. And this will take you to some fact sheets, some how-to guides, step-by-step documents, and this will definitely be useful as you start to explore some of those features in our site. And we also have a Contact Us page where you can reach us directly. You can reach myself, Sarah, and Patricia Tursteniak through that. And this comes to us directly, so when you fill out a form, we do see that, and sometimes we can respond even within a couple hours, but we do usually respond within 24 hours. So that's an option if you are looking at something and would like to reach us. So I'm going to go ahead and stop sharing my screen. And now we are going to round out the rest of the data components with Sarah.
Thanks, Libby. I'll go ahead and share my screen again. Okay, hopefully you all are seeing a PDF document. So the last thing that I wanted to show today is another data related tool on the site, and this is called the Location Report Builder. So this is a tool that allows you to build customized reports based on indicators and a location of interest. And it's a pretty easy and quick way to pull together different components on the site into a document that can be downloaded as a PDF. Do keep in mind that these reports are more of a snapshot in time, so the data included in them won't be updated like it would if you used a custom dashboard. But these reports, they can be used to help tell the story of your community, and it's nice because you can easily share them with others. So I thought we would start by taking a look at an example custom report that I created. And I included some maternal and infant health related indicators, as I saw that was another priority in the Summit County CHIP. So hopefully this isn't too tiny for you all. But in your reports, you can add headers, you can add custom text. I kept it fairly simple, and I've just included 3 indicators. So I've got preterm births. So up top here, I've got the indicator card for that. So I want to show the value and then some of those comparisons. I've included description of what the indicator is, as well as the data source. And then I've included some visuals. So I've got these graphs by age and race ethnicity, as well as a change over time graph. And then mothers who received early prenatal care, and mothers who smoked during pregnancy. And again, you can add as many or as few indicators as you want. And you can customize what different components you include, the size of them, etc. So again, that's just an example to give you a sense of what this tool can do. And then I'll go ahead and open up the website and just walk you through the steps of how to create a custom report. So to navigate to this tool, you would go to Tools and Resources and then build a custom report. So as you can see here, your first step is going to be to select a location. So I'm going to go ahead and select Summit County. And now you're going to see that this toolbar is showing. So this is where you can go ahead and start adding the various components to your report. So to add indicators, you would start by clicking Indicators. So here I'm again just going to do a keyword search for maternal and infant health. So if I had typed in all there, all of the indicators that are available for Summit County would show. But I did a keyword search. So you'll see here on the left, these are all of the indicators that are related to my keyword search that are available to add to my report. So if I select, for example, preterm births, as soon as you click on that, then on the right, the report components option, those are all populated. So there are various charts, gauges, indicator cards, maps, tables, and then some text, like the data source, what is this indicator that you can add to your report. You can hover over any of these components to get a quick visual of what that might look like in your report. So for the sake of example, I'll just go ahead and select a couple of these so you can see what those look like. And once you've made your selections, you would just click Add, and then all of those report components are going to be added into your report. If you wanted to add additional indicators, you would go back to the toolbar and click Indicators, and then just follow those same steps. And that second indicator, that would just be populated towards the bottom of your report. You can also add demographics data to your report. So on the left here, you're going to see the various categories that are available. And if you click on a category, you'll then see the various components. So we've got various bar and pie charts. We've got some tables, various values. So again, if you're so inclined, you can add that. You can also add socio needs index data, a map of the location you selected, and you can even add a legend, which might be helpful if you include an indicator card, just to help the person viewing your report interpret that. And as I mentioned, you can add custom text, and then there's options to add these horizontal or vertical lines if you want to use those just to break up your content. So to the right, you can see this edit versus preview mode. So right now we're in edit mode. And while in edit mode, this is where you can customize your report. You can delete components if you're not happy with them or if you accidentally added something just by clicking the X. You can click this pencil symbol and you can edit the text. So you could, center it, you could bold it, you could add bullets, etc. You can resize various components. So if you want to make this one smaller, you could just click and drag. You can even rearrange the order of components by dragging and dropping them. You can make any of these bar graphs smaller if you want to make that smaller. So once you have made all of those changes, if you want to see what your finished product might look like, you could click preview, just because it does take away all those edit options. And then once you're done creating your report, to save it, you go back to the toolbar and just click the save icon. And then you can download your report as the PDF. But say, for example, you're working on your report, but you're not done. You need to come back to it later. You can click temporarily save for later, and it will save your report to your web browser, just so long as you don't clear your cache. And then when you navigate back to the location report builder, there'll be an option to load that report that you were working on. So that's a nice feature. So again, that's how to create a custom report on the website. I do just want to acknowledge, I know we covered a fair amount today, but I hope you have a better sense of some of the data we have on the site and those various tools and resources available to you. And Libby, thanks again for pointing out the Contact Us page. So if any of you are on the site and you have questions, please don't hesitate to contact us. We're more than happy to help. So I'm going to go ahead and stop sharing, and then I'll turn things back over to Libby, who's going to wrap things up for us.
Thank you, Sarah. Okay, great. So we are going to go ahead and wrap up with our presentation this morning. And you should be seeing some of my slides now. Oops. Bear with me for just one moment. Sorry about that, everybody. I'm going to go ahead and do a couple background things here. Okay, it looks like I'm having a little bit of difficulty to pull up our final slide here, but while that is getting sorted out on my end, we will go ahead and start wrapping up. So go ahead and start entering those questions into the chat if you have not already. I know we have a couple more in here. A couple of things that I will point out, again, you can visit the Learn More tab on the website to find those how-to instructions or to also get our Contact Us page. We do have a nice variety of information on our site that I know we covered in a very short period of time. There was a lot that we fit into this last 50 minutes. So if you are interested in having a deeper dive of any specific topic, or if you would like an overview for your staff or for any coalitions or groups that you are a part of, we do encourage those, and we would be happy to fulfill those requests. And in summary, essentially, we were able to show you some of our key features on the site. We were also able to look at different resources that you might find valuable. And lastly, you were able to see how to do some reports, create some dashboards, etc. So as I'm still trying to pull up our final slide so you have our contact information, I'm going to go ahead and turn my video back on, and we will start to address some of those questions. So Sarah, one of the questions that we had, and we could probably provide some more insight on this, was do you know if there are plans to scale up to all of Ohio with the same format/vendor? So I mentioned earlier this morning, we do cover a 7 counties in our Northeast Ohio region, and we are hoping to increase that to 9, but we are currently limited by the region of the Center for Health Affairs. So we do not know if there are plans outside of our Northeast Ohio region to use this vendor. We would be interested to hear more about that. And Sarah, do you have any insight for that?
Thanks, Libby. I was going to say the same thing, that right now we're in 7 counties, but this year we're planning to add 2 additional counties to bring that up to 9 to match the service area for the Center for Health Affairs. I would say almost all of the indicators have general like Ohio available for a geographic level. But yeah, right now I think our efforts are mainly focused on Northeast Ohio region. But obviously we'll see how things unravel moving forward. But thanks for that question.
Yes, that is a great question. We do know that there are efforts that are similar to ours in other parts of the country, but yes, we do like how innovative and interactive this platform is. I'm going to go ahead and share my final slide here. I finally got it to come back up. I know there are always technology glitches in this COVID world that we live in, so I'm going to pull up our Contact Us page so that you can see how to get a hold of myself or Sarah or Patricia. So bear with me for one moment and we will go ahead and wrap up. Okay, great. So you should be seeing finally our contact information for myself and for Sarah and Patricia. Again, you will be able to contact us through the page. And I will also be sending out a follow-up survey, including the link to the webinar from this morning. So please also feel free to reach out to us directly that way as well. I'm going to go ahead and check the chat. Thank you. This is very educational. That's great. We are so glad to hear that. We love seeing this feedback. So we hope that all of you were able to walk away with a little bit more information about how to use our platform. So we will go ahead and leave this up for another moment or two. And if there are not questions, we will go ahead and give you a couple minutes of your day back. But we will go ahead and leave it open for another moment of questions. And if there is not anything, we thank you for your participation and for joining us this morning. Okay, great. Awesome. All right. Well, thank you so much, everyone. Feel free to get in touch with us if you have any additional questions, and we hope you have a great rest of your day.
Thank you all so much.